How to manage increased intracranial pressure, ICP, in trauma. Have you ever wondered how medical professionals tackle the challenge of increased intracranial pressure in trauma cases? This condition can arise from head injuries and is a serious concern. Managing increased intracranial pressure is essential to prevent further brain damage and improve chances of survival. Let's break down the steps involved in this critical process. Increased intracranial pressure refers to the pressure created by fluids, such as cerebrospinal fluid and blood, inside the skull. Trauma can lead to swelling, bleeding, or fluid accumulation, all of which can elevate this pressure. When intracranial pressure rises, it can damage brain tissue and disrupt blood flow, leading to severe consequences. The initial management of increased intracranial pressure starts with positioning. Elevating the head of the bed to more than 30 degrees helps promote venous drainage from the brain, reducing pressure. Keeping the neck in a neutral midline position is also important to avoid obstructing blood flow. Monitoring neurological status is crucial. Medical teams look for any signs of deterioration, such as changes in consciousness or pupil size. Maintaining adequate oxygen levels is vital, with oxygen saturation above 95% and carbon dioxide levels around 35 to 45 millimeters of mercury. This helps optimize oxygen delivery to the brain and prevents conditions that could increase intracranial pressure. Blood pressure control is another key aspect. Ensuring sufficient cerebral perfusion pressure is necessary, with a systolic blood pressure above 100 millimeters of mercury to avoid hypotension. For more advanced monitoring and interventions, intracranial pressure monitors can be used. An external ventricular drain can not only monitor pressure but also drain cerebrospinal fluid to relieving pressure. Sedation and pain relief are important as well, as they help lower metabolic demand and prevent agitation, which can raise intracranial pressure. In some cases, osmotic agents like mannitol or hypertonic saline may be administered. These substances draw fluid out of brain tissue, helping to reduce swelling. Surgical options, such as decompressive craniectomy, may be necessary to physically relieving pressure on the brain. Coordination among trauma surgeons, neurosurgeons, neurointensivists, and critical care teams is essential for optimal management. In high-risk professions like logging, deep-sea fishing, or storm chasing, where trauma risks are elevated, understanding these principles is vital. Rapid identification of head injury signs and prompt basic interventions can be life-saving before transferring to specialized care. After the acute management phase, rehabilitation plays a significant role. Physical therapy, occupational therapy, and speech therapy support recovery. Education on avoiding activities that could worsen brain injury is also important. Involvement from social work and primary care ensures a safe transition home and ongoing monitoring. Managing increased intracranial pressure in trauma involves a blend of positioning, monitoring, medical treatment, and sometimes surgery, all coordinated by a dedicated team. For those in high-risk professions, awareness and early action can significantly impact outcomes in traumatic brain injuries.